Finding your way with ocular melanoma, join me, host Tara McCannell, as I share with you everything I know about ocular melanoma. I hope you will learn, get your questions answered, and be motivated to improve your overall health. Visit my resource page, sayhart.com/ocular melanoma. That's SEYHART/ocular melanoma for more resources and support. There you will find access to my new book, A Handbook for Patients and Families with Ocular Melanoma, my previously recorded webinars, past episodes of this podcast, additional resources, as well as personalized support and help to help you through this cancer. I encourage you to follow, subscribe, ask me questions, share with friends, share with your doctors, so that others who are looking for information can find us more easily. Today, I'd like to talk about bleeding in the eye. Does bleeding in the eye with a melanoma increase the risk of metastasis? The answer is no. Let me just get that out there. And let me tell you about why this topic is important. When you have a cancer in your eye, by definition, a cancer in the eye, a cancer in another part of the body, there is abnormal growth of tissue that shouldn't be there. In order for this tissue to grow, it does develop its own blood supply. So part of the growing tumor cells is also growing vascular supply. So all sorts of vessels that normally shouldn't exist grow together with the growing tumor. So when you have a cancer in the eye, such as ocular melanoma, there has to be abnormal vessel growth as part of abnormal tumor growth. So you always have a very vigorous and aggressive supply of vessels that help feed and nourish a rapidly growing collection of dysfunctional cells. So blood vessels are always part of this. The question that comes up that I answer a lot of the time is, if there's bleeding from the tumor, does this pose additional risk for me? And the answer is no. A lot of times we feel that if there's bleeding in the tumor, there must be more bleeding in the body and blood flows through the body. So therefore, cancer cells may more easily spread in the body. And that's sort of my layperson putting myself in the shoes of someone who might not understand this. And I think there is some misunderstanding about how blood vessels work, how cancer spreads in the body. So that's where this comes from. And I want to try to help make you better understand blood supply, when we see bleeding in the eye, and what it means. So let me be clear. If your melanoma bleeds, or if something is done to it that makes it bleed, this is not going to increase the tumor cells that spread in the body. If your melanoma is going to metastasize, it will do so whether you have surgery on the eye, whether you put something in and stir the cancer up by ocular surgery, by putting a needle in that causes bleeding, and even if you just take the eye out from the get-go. If it's going to metastasize, the conditions that make it metastasize really have nothing to do with what we do to the eye. So if your melanoma bleeds, that doesn't increase or decrease the risk that the cancer spreads. Because when the melanoma bleeds in the eye, that blood stays in the eye. If the melanoma bleeds, the blood does not get out of the eye, it doesn't go into the body. If you have melanoma surgery and there is some blood involved in opening the superficial tissues, that blood flows out onto the drapes and gets tossed away. That blood doesn't go back into your body because there's always a constant, your heart is pumping, so blood is always flowing through vessels. Blood doesn't go back into vessels and get back into the body. Now, when you have melanoma surgery, there are many instances where the tumor bleeds. Number one, first of all, even if you don't have surgery at the time of diagnosis, many times we find that there's blood in the eye together with the newly discovered melanoma. Does that increase risk? Does that make it a more serious situation? Absolutely not. Blood is just a mechanical byproduct of a growing tumor. And when we see blood in the eye, usually because the cancer is growing, it's outstripping its blood supply, or even physical motion can cause those blood vessels, which are fragile, to bleed. And then we look in the eye and we see blood. So if you flick your eyeball with your finger, you might cause fragile blood vessels in a tumor to squirt out, and then you see blood in the eye. During melanoma surgery, when we identify when we identify the muscles that we need to help turn the eye for brachytherapy plaque surgery, even just turning the eye during surgery, and we look inside with our lights, we may see blood there that wasn't there before surgery. So just manipulations and jiggling and pushing around on an eye that has a very friable, fragile blood vessel supplied tumor is going to cause some bleeding. And certainly when we put the plaque in place, if a person has a biopsy, if a person has vitrectomy, there can be some blood from the tumor. Totally normal, and we kind of expect it when we go and do surgery on the eye. So bleeding doesn't mean that the cancer is spreading in the body. Very important. So I don't want people to be alarmed if there's a comment of, oh, there's blood in the eye. Oh, you have a hemorrhage that showed up in the postoperative period. There's another situation where sometimes we see blood. This is after treatment, maybe it's a year or so later, and you're getting an eye exam, and an eye care provider looks in or takes a photograph and says, oh, there's some blood there on the tumor. That looks serious. And usually, when an eye care provider who is less familiar with ocular melanoma sees blood, what is the first thing they think about? They think this must mean the cancer's coming back, that it's still active, that there's a serious problem. When in fact, seeing blood in every possible way, shape, or form is very normal after a melanoma has been radiated and the tumor has been killed. Sometimes we see patches of blood in other parts of the eye that are kind of far away from the treated melanoma. And the eye is a little bit abnormal. And so we sometimes see things that are unexpected. But the most important thing is that those discoveries don't change your metastatic prognosis at all. If anybody looks in your eye and has concern, it's very important to go back to your ocular oncologist and just double check everything. Confirm that the tumor's killed, have the ultrasound, and honestly, ultrasonography is the #1 key test if you want to know that the melanoma has come back or if there's tumor recurrence. Ultrasonography is key. If the ultrasound doesn't show any increased growth at all and there's some blood there, we just monitor. There is no reason to be scared if the doctors see some blood in the eye. So I just want to summarize by saying bleeding is a mechanical, normal feature in the setting of a growing cancer. We're always going to see some bleeding. And sometimes we look in and maybe it bled and the blood is cleared and we see signs that there was old blood. Does not increase your risk of metastasis. Bleeding can happen during surgery with manipulation, maybe sometimes with a biopsy. And bleeding can happen down the road after the tumor has been killed, it's shriveled, and we see a burst blood vessel. That's because dead tissue still has some of those vessels that are sitting there and they may just bleed. It doesn't increase your risk of the cancer spreading because that blood just stays in the eye. And if the tumor is treated and we have proof that it's dead by our monitoring and ultrasound, there is nothing to worry about with regards to the cancer spreading. So I hope this answered your questions and concerns about, is bleeding in the eye worrisome? Does it increase the risk of metastasis? The answer is no. I hope this was helpful, and I look forward to chatting next time. Thank you.